Hello, everyone, and welcome to the Learning Lab podcast by Funds for NGOs, where we bring you practical insight, expert guidance, and real experiences from across the global development sector. I am Anutma, and we are honored to host Dr. Nirmalya Mukherjee, Chief Executive at MANT and the Center for Public Health Research, India. Today's topic for podcast is Evolution of NGOs in India and the Way Forward. In this conversation, we will explore how the NGO sector in India has evolved, the current challenges organizations face, strategies for sustainability, the importance of partnerships, and your advice for the next generation of social sector leaders. Dr. Mukherjee, welcome to the Learning Lab podcast. To begin, could you please briefly share your journey and highlight the work your organization is doing to support marginalized communities?
Yeah, thank you, Anutma, and I must be thankful to the Funds for NGO for inviting me to share my experience. But I must be very candid to say that coming the 25 years of experience within 1 or 2 minutes, it will be very difficult. But I am trying. Over more than 25 years of experience in health and development, the transformation of India's NGO sector, what I have witnessed, has been nothing short of dramatic. So it has come from a golden era of extensive growth to a constrained but resilient presence. So the late 90s, when my career began, India was the midst of an NGO boom. So liberalization had opened the doors to international funding. Civil society organizations were rushing to fill every gap rather. The state that state could not, like running the health clinics, empowering the women, protecting the environment, and so on and so forth. Even the fighting for corruption is also a good instance. By 2009, India had around almost 3.3 million registered NGOs. So nearly one for every 400 citizens in the country. Now, for those of us in public health, this was a time of extraordinary energy. So NGOs were trusted partners of the government, helping them implement welfare schemes at the grassroots, and pioneering the community-led models that larger programs would later replicate. Now, as the sector grew, and in the midst of 2000s, it also professionalized. Number one. Number two, that volunteer-driven activism gave away the structured, donor-centered or donor-oriented operations, and obviously efficiency improved. But there is a huge problem of distance grew between the organizations and the communities they served. So the funders' centralized authority, their mission deals yielded to donor priorities, and accountability mechanisms often lagged behind. So this is the a time when we are started to struggle. Now some NGOs began chasing grants at the expense of their own mission. So one example I can give. So doing whatever donors wanted, other than the communities that they have been serving and their need. So this is the huge issue. Now internal flaws compounded by the occasional financial scandals are also surfaced, and these has steadily eroded the public trust in NGOs. Now, from 2010 onwards, so the most consequential shift happened from the state's growing assertiveness in various aspects. Especially the FCRA was amended in 2010 initially, again in 2020, and it has become a powerful tool to regulate. And in many cases, it restricted the flow of foreign funds to NGOs. Many foreign funded or foreign NGOs left in a country. FCRA registration became much more stringent, and almost 19,000 NGOs were they lost their registrations. So this is a huge issue at that point of time. And administrative expenses under FCRA caps slashed from 50% to 20%. And the most important one, the sub granting was prohibited. So the collaboration with the various small NGOs became very harder. Rather, it's almost impossible. So at this point of time, what I understood, even I argued that in my recent op-ed published in the Telegraph on 22nd of November last year, the trajectory of India's NGOs mirrors the evolution of India's democracy itself. The sector remains vast, that I must admit, and it contributing around 2% of the GDP, but it is under real strain, that we should admit. And now the survival of NGOs demands adaptation on several fronts. So I argued on four things. First, that the radical transparency should be there. So the publishing the budgets and the project results in local languages, so that should be there to build the bottom-up accountability. Number one. Number two, that funding diversification is a major issue. So moving beyond the foreign donors towards domestic CSR funds, local philanthropies, even the crowdfunding also, citizens contributions by having the crowdfunding. So this will help the NGOs far less vulnerable to the external policy shifts. So this is a very important one. The third one, that innovation and collaboration. So the embracing the technology, the ERP model for NGO management, social enterprise models, and having a broad range of coalitions that allow the smaller groups come together, and they can share the compliance and the training costs. So this also very important. And the last one, that is I think the most important one for India's democracy. If NGOs become mere service delivery contractors and too timid to question the authority, then their democratic functions dies. So maintaining an independent and critical voice is non-negotiable for an NGO, because their credibility lies on that. And lastly, I must say that having spent over a quarter century in this very space, my conviction is very clear. So civil society organizations remains indispensable. They are there. The challenges of public health, as I am in public health mostly, so like tobacco control or snake bite management or indigenous health, that cannot be addressed by the governments alone. And the NGOs must earn their relevance anew because of this. And by being transparent, we should be very transparent, we should be locally rooted, we should be financially resilient, and obviously unapologetically vocal for the people that we have been serving. And if they emerge from this very crisis stronger and more community-centered, all of Indian society stands to gain. So that's my understanding.
Thank you, sir, for your inputs and your knowledge sharing. So I just want to know, what have been the most significant turning points that shaped NGO sector in India's public health landscape?
So there are several, pivotal moments have shaped or reshaped the NGO public health interface in India. The HIV/AIDS crisis of the 1990s was arguably the first, great catalyst. So I think NGOs, NACOs, successive AIDS control programs drew thousands of NGOs into surveillance, prevention, treatment, and it has established a lasting model of government civil society partnership. So we are, Eastern RISE in eastern part of India. That means Regional Institute for Capacity Building and Evaluation under NACO's Saksham Praman project. So we have been evaluating the NGOs, those who are basically implementing targeted interventions as well as link worker schemes. So we have been witnessing this sort of sustainable, or rather I can say stronger relationship between the government as well as the NGOs in this very sector still remain there. So this is a I think very important a moment for us. The second one, that the pulse polio campaign 1995 onwards, I think I can recall correctly, so demonstrated that what NGOs could achieve at scale. So in UNICEF's social mobilization network, it has deployed over 7,000 frontline workers, and civil society groups, helped immunize, 170 million children per round,
Yes.
contributing to the, India's pulse polio, rather polio-free certification in 2014. The National Rural Health Mission in 2005, it is also very pivotal moment for NGOs because it has formally institutionalized NGOs participation, even in the primary healthcare delivery, communicating, monitoring results with the government. Even the community monitoring is there. Then the health worker training is also very important aspect that NGOs were doing and have been doing. Then came to the turning points of the constraint that I have already mentioned, that FCRA amendment happened in 2010 and consequently again in 2020. That has drastically curtailed the foreign funding, forcing the sector basically to rethink its financial models. So the most recently, COVID-19, that has also been very important, milestone in government NGO relationship. So that has exposed the fragility of the public health infrastructure and the trust NGOs that NGOs have are I think having that and that helped us back into the spotlight as the frontline gap fillers. So many NGOs at that point of time they started to run the oxygen banks, facilitating the vaccinations, supporting the migrant communities, like running the community kitchen, what we did over here in Purulia, uh, uh, and that were completely backed up by the state system. So this is also very important. And I must admit that each turning point redefined the sector's boundaries, the capabilities, and the relationship with the states.
Yes. Uh, the next is from your experience, why is evidence based research crucial for NGOs to design impactful and fundable interventions?
Ah, it's a very interesting question that I must admit.
Yes.
Uh, in 2017, when we started the Center for Public Health Research in our organization as an institution, so we understood that that evidence-based research is the backbone of credible, impactful, and fundable NGO work. And this conviction has only deepened over my 25 years of experience in this very sector. So it replaces intuition with accountability. So too many well-meaning interventions fails. What I have perceived, I have experienced over the years, because these very interventions, though they are well-meaning, but they are designed around assumptions. So whatever perceptions or assumptions that we are having right now, or having as an individual, we have usually give much more importance, but we seldom give the evidence importance on the evidence. Now, grounding program design in systematic reviews, baseline data, proven frameworks, like what works already, what didn't work in other parts of the country or other parts of the area where we have been working, or with the people, the indigenous people, like in the intervention happened in Gond area in Madhya Pradesh, might
Yes.
not be working in Purulia, but we can understand that what works over there that can be replicated over here also, and that will also ensure that limited resources that targets what actually works, not only mere the fields right. So this is what is very important. Now the second one, it is also very important to note for every NGOs who have been struggling for funds, that it has become a funding prerequisite rather. So donors, I think whatever, whether they are basically the bilateral agencies or CSR funders or the foundations like Gates Foundation, so they have been increasingly demanding rigorous evidence of need, cost effectiveness, cost benefit analysis, and measurable outcomes before committing the resources, because this is very important for them also. They have to, because they are also accountable to their funders
Yes.
or their authorities. Now, a proposal without evidence base is, in today's landscape, for me, it's a proposal without any credibility. Now, the third one that is also very important, because it bridges the research and the implementation. So through evidence synthesis and implementation science, NGOs can adapt globally validated interventions to local context. Like, understanding not just what works, but how and for whom it works. So we have implemented, three evidence-based evidence implementation project with support from Australia Award Fellowship in collaboration with the Adelaide University, and we have learned a lot. And I must say that this is uh, precisely for what we have established the JBI Affiliate Center for Evidence Synthesis at MANT. So this is basically for the embedding this discipline into the grassroots and public health action, and we have seen that that this kind of evidence implementation projects yield I think huge results for us. So one or two things, only one or two, three trainings can change the everything. Almost a shift from 90% to the 95% of the efficiency or effectiveness. So this is what is very important. And lastly, it also build trust. So in an area of rather I can say in this very present condition, present scenario, so we can tell us that or you will be telling us that it's a syncing civil space and a heightened scrutiny. The NGOs can demonstrate evidence-driven impact. They should earn legitimacy with the communities, governments, and funders alike. So that means making the evidence not just a scientific imperative, but a survival strategy for the future.
Yeah, thank you for this answer. The next, we want to share with all the audience what practical steps can grassroots NGOs take to build strong research capacity and credibility?
Yeah, so this is very important for me also because I have learned a lot by establishing this Center for Public Health Research. So what I understood from this very experience from mine, that building research capacity at the grassroots is not a luxury. It is a necessity for NGOs that want to remain relevant and fundable. So what I have done in my organization, and I would suggest that everyone should go with that. First one, that start with what you already have. So don't go for a very huge things. Don't think about we will do this or that, but you should focus on the collected data. We have every grassroots NGOs are collecting field data. So it might be case records, it might be service registers, it might be community feedback, all those stuff. Now, the first step is to listening to the communities and all those things like case record, service register, all those stuff, that whatever data we are having, that should be kind of a first step for learning to, and we should, by doing systematize the data and analyze the data and transforming the routine documentation into usable evidence. So one example I can give what we have done. So simple monitoring and evaluation frameworks, that also helped us to put the program outputs into a credible impact narratives. So this is what is very important. Now, the second one is the partnering with the academia, because we don't have that much of infrastructure or other resources to have the in-house infrastructure, which will help you to understand the or rather I can say the methodological rigor to have that in your organization. So the formal affiliations with the universities or research centers at the country or outside, as we have done this with the University of Adelaide, University of Denver, Colorado, University of Pretoria in South Africa, even with our Manipal Academy of Higher Education, because we are the doctoral training center for affiliated to Manipal. And this gives us kind of access to the methodological rigor first. The second one, that that we have published various platforms in peer reviewed ones, and we have also mentorship support without any building that I have already told you, the costly in-house infrastructure. Now we should invest. The third one that is also very important, that is staff training. So structured participatory research training, covering various issues that that we are going to implement or should focus on. So this is also very important, and we should cover the basic study design, sampling frame, data collection formats, how we can collect the data, and this will help the field workers to become co-investigators rather than the mere data collectors also. Uh, the fourth one that is also very important, that is publish as well as communicate the findings. In our case, we always believe that uh, if you publish, then you will survive. If you are not going to publish, you would be perished. So the peer reviewed publications, policy briefs, impact reports, that are very important to build the organization's intellectual credibility with the donors and the governments alike. And the last one that I must admit, that we should be very transparent. So we might be utter failure. So I can tell you that we honestly shared that two did.
So the next we were discussing, the next question is what skills and mindset will future NGO leaders and change makers need to stay relevant in the next decade?
Okay, so the future leaders, what you are trying to say?
Yes, yes.
Yeah. So the next decade basically belong to NGO leaders who combine the mission and conviction with modern capability. So this is what is I strongly believe in this. The LinkedIn data, I was just reviewing that. So it projects that that professional skill set are basically helpful for us, because that will change by 60% to 20 by 2030. The sector is this sector is no exception, and the social sector is, rather I can say that this is a quite a possibility that the professional skill set will change by almost 60% by 2030. So in that case, we should have a kind of like beyond instinct to data driven decision making. Concretely, that I must say that that it means that staff trained to run the M&E dashboards, like on tools like Power BI and program lead, using the AI to summarize the field reports or visualize the outcomes for donors. For example, at MANT, we have been embedded the evidence synthesis in the grassroots programming that required exactly this shift, like turning the field workers into a data contributors, not just the data subjects. So this is very important. The second one, that adaptive leadership. So the Drexel University's Mitchell's Edmondson frames it well. So he came up with a huge I think replicable model. So it is telling that the top competency is leveraging the positive uncertainty. That means treating the disruption as an opportunity. So when COVID-19 shut down field operations, NGOs that pivoted the telehealth and digital outreach provided services, they survived. So those that waited for the normalcy, they didn't. So this is what is very important to understand that.
Thank you so much, Doctor. Thank you for sharing your valuable insight and experiences with us. Stay tuned for more episodes of the Learning Lab podcast. Thank you so much. Thank you, Doctor, for joining us.